So good morning, everybody. I'm Dr. David Crichton. I'm the Chief Medical Officer at South Yorkshire Integrated Care Board, and I've got executive lead responsibilities for research and innovation. This morning's meeting is our Bitesize series, and today we'll be focusing on Talking Together pathway, and I'm pleased to be joined by Becky, Massey and Alison Fleetwood from Doncaster Local Authority. These webinars are a series of highlight for research and innovation and best practice across here in South Yorkshire, and they've been running since September, and we'll run them into the new year. Each has got a different theme each month, and we'll cover subjects such as cancer, children and young people's prevention, workforce and the economy. Aligned to the 10-year health plan, we hope that we can maintain energy around our innovation and national priorities, and enhance our problem solving and foster growth, that we can help each other in the health and care industry. We hope you feel inspired by today's speakers. I'm certainly looking forward to it. Just got a few colleagues who are joining us, so welcome. We're just about to hand over to our presentations today. So welcome, Becky and Alison. I'm going to hand over to you. I think you've got some slides to present to us today. So we've got about 20 minutes for your presentation, and then we'll pick up any questions at the end of it. So I'll pass over to you. Thank you.
Thank you, David. So hi everyone, my name's Alison Fleetwood. I am the Service Manager for Early Intervention and Prevention, and I lead on the Talking Together programme. I'll just let you introduce yourself, Becky.
Yeah, and I'm Becky Massey. I'm the Clinical Lead Speech and Language Therapist for the Talking Together pathway.
So we're going to try and give you a whistle-stop tour of our journey so far, and it is a journey. We're very much sort of on that journey. We're not at the end, but we were happy to share sort of our journey so far and some of the learning that we have taken. If you could just move on the slides. Thank you, Becky. So we're going to start off by giving you just a little bit of a background around how the programme began and sort of how that decision making happened. We'll talk about the team and what that looks like and what capacity and resource we have there. And then I'm going to hand over to Becky, who will then give you an overview of how we separate our offer against the universal approach, so for all families in Doncaster, and then our targeted offer for those children that just need that little bit of extra support. She's also going to share with you some of the impact that we're seeing through our approach, and then talk about some of our next steps. So how we began. So in 2019, we were awarded 250,000 from the DFE for the Early Years Outcome Fund. So that was a South Yorkshire-wide project across Doncaster, Sheffield, Barnsley and Rotherham. And it was around how to improve local systems to support speech, language and communication. So the project is now known as Talking Together. And that's the South Yorkshire-wide project, but you'll see that in Rotherham or Barnsley, you might know it as Tiny Talkers. Each of us had the freedom and the flexibility to aim the programme in the way that we felt was needed for our local authorities, while making sure that we had a consistent framework to our approach. Progress against the programme was delayed due to COVID. As we all know, that sort of put a firm stop to a lot of things, but what it did do is give us that bit of time to really think about how we were going to drive this forwards. What we have made sure is that we've embedded it within the family hubs and the Best Start for Life to ensure that there's that holistic, family-centred approach. So the team itself is made up of myself and Becky, the speech and language therapist, and then we have 4 Talking Together practitioners who all do the direct work with children and families across Doncaster. There's a mixed bag of skills across the team in terms of clinical speech and language therapy, and then also early years childcare and education backgrounds, and showing that we've got that real breadth of approach across how we are planning and delivering those interventions with children and families. So we have a joint commissioning model. So this developed sort of very slow and steady. So originally we had 2 days a week of a speech and language therapist to help us really start to look at those pathways and identify how we're going to make sure that we've got that real graduated approach to support across Doncaster and what that might look like. So the capacity, that 2-day-a-week capacity helped us completely rewrite our communication checklist, which is our referral format for our speech therapy service. And we've done a RAG rating system across that pathway, which very clearly states for our families whether they just access universal provision, whether they meet the criteria for talking together support, or whether they then go into the more specialist services across the speech therapy. What this has provided, so my colleague Becky will be hearing from shortly, is on an NHS contract. She's recruited by the NHS and sits within the NHS team, but she's also firmly embedded within the local authority team and oversees directly the work of the 4 local authority recruited practitioners. What this has allowed for is those joint shadowing opportunities, that opportunity for networking, and there's been some real quick wins around shared knowledge from both sides in terms of upskilling either way. It also allows for that clinical supervision and those practical things such as access to both systems and being able to make sure that none of those children slip through the net and that those healthy conversations can happen to get the right support for the children at the earliest opportunity. What we're also finding is that we've got much more fluid transitions now between targeted and specialist services, because we've made sure that we've aligned that support that we're providing so that when it has been recognised that a child would benefit from that targeted and specialist support, we know exactly what needs to happen so that they're ready to engage with that support at that time. We've also seen a direct impact on the level of need that is going through to our speech therapy services, with a reduction now in the number of children that are on that waiting list for that acute support, and we're hoping that that will continue to be the case. Have I missed anything on there, Becky? No, I think that's it, isn't it? So it's over to you.
So I'm going to talk about our offer. We run, as Alison said, we've got 2 arms to our offer. We have our universal offer, which is open to all families, and our targeted offer for those children that just need a little bit of extra support. So under our universal offer, we provide training to any professional who will come across a child aged 0 to 5 within their working day. And this is to increase the knowledge of the importance of early communication and language skills in later life, and how getting it right in those kind of first 5 years really does support and set a child up for that best start in life. We provide advice through our website and our social media page. So we have a Facebook page that's predominantly parents with some childminders and early years professionals on there. And this is an example of one of our posts. So we do lots of tips, tricks, how to utilise certain activities, craft ideas, all centred around that sort of rich language environment in the home. We run drop-in sessions from our family hubs. So parents book onto these, but there's no need for a referral. So anyone can access it with a child aged 5 and under from any age. So if they've got any concerns at all, they can come and access that advice. We then follow up with supporting them into any services that we feel might be necessary as well. We have a presence at any events run by the family hubs. So the teams are fully embedded within their locality hubs, and they make really good relationships with the professionals so that they can attend any of the events aimed at either other professionals within the partnership or at families as well, so they can be on hand to offer that advice and signposting. And then we've made links with local cafes as well. So we provided them with a little box of books for families to access while they're in the cafe, along with top tips for talking. So we're trying to engage families at all times within the community and encourage those rich interactions when they're out and about. With our targeted offer, this is for children aged between 2 and 4 who need a little bit of extra help with their talking. We offer a mix of licensed and self-developed interventions, just so that we can fully support the needs of the families. We started with the licensed packages and then found quite quickly that because with a license and home talk being evidence-based, there's very strict criteria on who can access those pathways. We wanted to ensure that we were providing support for all of the needs of the children coming through to us. So we also developed our own services alongside those. So our licence packages are Home Talk, which is a home visit based intervention, and Growing Together, which is a group based intervention. And that, Growing Talk was our licensed group visit, group session, sorry. Growing Together is one of our home visit based services. And then our groups, we have Talking Together, which was adapted from the Growing Talk groups with permission from the owner of Growing Talk. And then we also have Let's Play Together, which is our intervention for children who need support with their attention and listening. Children, when they're referred into our service, are offered an initial visit within 1 calendar month of being referred in. This allows us to signpost to any other services that families might need. We can pick up on need quite quickly, offer initial advice, and then at that point they're placed on the waiting list. When we first started, we put them onto the waiting list first, and then we didn't see them for a number of months after that, but we found that this way we're able to get into those homes quickly, identify any additional needs and any other services that might support. All of our interventions are based on supporting that home learning environment. So we do parent coaching, and we support parents to enrich their child's interactions at home by offering other activities, all at low cost or no cost, and practitioners will often leave resources behind as well, because we don't want families to feel that they're having to go out and purchase anything to be able to support their child's development. So with our impact, all these figures are taken from between April 24 and March 25. We received 364 referrals, and of those that were seen for an initial visit, 204 were placed on the waiting list for intervention. In that time period, 110 children were closed to our service, so that means that they reached the end of their intervention package that we offered. We had 57% of children were signposted onto universal services, so that means that they didn't have any more support needs and they had met their developmental milestones. We had 36% of children requiring further support from the speech and language therapy service, and then 7% of children who had additional SEN needs that needed supporting within their setting. All of the children at the end of their intervention receive a little teddy with the Talking Together logo on, just so that we're fully embedding that kind of practice within the home. They get that as a little reminder of what they've achieved through our service. With our advice sessions, these are really well attended. We had 116 families attend through that year period, and this enabled us to identify children that needed support earlier. In Doncaster, our 2-year check has moved to 2 years, 3 months for the health visitor check, so that for those families that were placed on watchful wait previously, they weren't having that at that 2-year check anymore. The 2 years, 3 months would when they would identify need. But because we offer the advice sessions to children of all ages, it means that children under 2 can access us. And then if we feel that they're going to need continued support, we invite them back at 23 months so that we can refer them into the service at the earliest opportunity. That often means that by that 2-year, 3-month check, they've at the very least had their initial visit, if not further support from us. Here you can see that predominantly this big section here, let me just get the pointer on, so this big section here, this is children who have been referred into our targeted intervention, so into the Talking Together pathway from our advice sessions, so that's 41%. This white section here is those children that we're inviting back, so we're accessing them much earlier. And then we have children that were at their expected level of development and parents just wanted that little bit of extra support and reassurance. We have children that we then signposted onto the specialist service, and then we supported with accessing SEN services as well from our advice sessions. We also offer training to professionals who will be providing targeted intervention in their settings. So often this is early years professionals and childminders. So between the last tax year, we had 73 professionals complete our universal training, with 61 professionals going on to complete our enhanced training. And these are our figures for overall, because we've seen a reduction in our training rates recently, but we think that's because we've actually trained so many people now. It was very popular when we first started, that we're seeing that actually a lot of our professionals have now accessed it. A lot of our settings have had at least one member of staff access either the universal or the enhanced training. And the picture there is just an image of a setup that one of our childminders created the day after her training with us, which was really lovely to see. And then we have some case studies here. I'll touch on these quickly so that you've got some of the ideas from them. So for all of these children, they all received that intervention focused on the parent coaching and the home learning environment. So for WK, he was referred into our service. He was very shy initially, hadn't had much opportunity to interact with others outside the family home. So the intervention really focused on that kind of modelling keywords, building his confidence through play. They were a bilingual family. He hadn't had much access to English. Parents were doing everything in Polish, which we absolutely continue to recommend. So our practitioner worked with the families, spoke about their strategies in English, and then parents carried them out directly with the child in Polish. And you can see here at the start of intervention, he had 2 single words, and by the end of the input, he was using over 140 words and regularly combining 3 to 4 words. At the bottom, we have one of our children who had been accessing the family hubs from a really young age. That meant that the family hub practitioner was able to pick up on his need really quickly, signposted him into talking together, and he was able to access support really early. He was initially using 4 words and communicating through gestures and vocalizations. Also, he was accessing family hubs, but he wasn't accessing nursery at that point. So our practitioner supported mum to feel confident in taking up his funded hours. By the end of intervention, he was attending nursery regularly, using 65 words, and by the end of the review period, was combining 3-word phrases. Some more here. We look at how we've impacted the family beyond just the word count as well. So we're looking here at their engagement wider in the community. One of our parents was struggling with the child's behaviour as well and his attention and listening skills. So we referred them to our attention and listening group, but also for one of our EPEC being a parent courses. So that's empowering parents, empowering communities. So the mum completed both groups. She then also went on to train and become a group leader as well. And then the increased his language skills to using 2 to 3 word phrases consistently by the end of support. So we've had the impact there on D, but also on parent as well, because she's now actively leading those groups. And then finally, one of our children, this was one of our early children, our early success stories. Mum had been massively impacted by COVID and was really not confident about taking him out, really unsure on what to do. They spent a lot of time watching TV together, which was mum's way of kind of connecting. She wasn't sure how to do that through play. So our practitioner spent a lot of time modelling those language strategies through play, focusing on serve and return interactions. And this picture at the side is a picture that mum was really proud to show our practitioner that she'd completed with her child in between the sessions, and talking about all the rich language that she'd been modelling during those sessions. And we've just got some feedback here that I'll leave on the screen, but I believe we're going to head into a Q&A section after some more polls.
Thanks very much, both. That was interesting from my perspective, having not been that close to this speciality in the past. So we said that if you want to ask any questions, please do pop them in the chat, and we'll pick those up. Just as a bit of a chair's prerogative on this. What struck me is we know how important that speech is in regards to sort of early development, and it's clearly linked with sort of educational attainment. So I suppose my question is it would be helpful, following what you've presented, how we flow these children through. I guess we haven't got something to compare it, but we hope that we do see the successes that exist. So just while I'm waiting for other people, I just wonder if that's something that you've thought of as your programme, of looking at some of the other sort of outcome measures that we might want to consider. Are either of you able to just come back on that point?
Yeah, it's really interesting, David, because we are exploring it at the minute with some research partners around whether we can do a little bit of a tracking study. So by sort of looking at our data, we know that the children that we first did some real direct work with will be sort of joining reception next year. So we should start to be able to see some of that impact in our EYFSP scores and our GLD from next year. So what we're wanting to do is just do that little bit of tracking with some statistical neighbours and sort of comparing against those that have received support and those that haven't, and seeing whether we can see any sort of difference there on a more longer term status than what we've currently got in our data set.
And I've got a bit of a follow-on question for that as well. And it's just that it's been suggested there might be some links with delays in early speech and communication and the prevalence of neurodiversity. Now, you might not be aware of that, and I don't, I haven't seen the hard evidence, but I think there is a connection that we it seems realistic that might be something. So once again, on that description, you just fed back about how we follow into education. I think that would be another area where it would be quite helpful to see if these children do go on to have a diagnosis of autism or that. But I don't know if that's something you'd been aware of, but it's certainly something that medicine is kind of made a bit of an association, but we haven't got the proof yet.
We definitely had to amend our process right at the start. We found that we were getting a lot of children that were neurodivergent that were coming through. And what was happening with that is that was skewing our data, our ability to make an impact on those children. So we had to tweak sort of our criteria to make sure that we were prioritising those children that we knew we could make the most difference with. And as you can see from the data there, 57% of the children, if we hadn't have seen those, they would have been presenting as query neurodivergent further down the line. But because we have been able to get in there at that earliest opportunity and really turn those things around for that child, that's 57% of a cohort that will then hopefully continue to progress. And one of the things that we've done with our programme as well is that we don't just stop the intervention and capture the point there. We do a 3-month check-in. So 3 months after that intervention has happened, we go back out to the family and just do that check-in and just double sense check that sort of improvement is continuing on the right trajectory and that it's not gone backwards.
Thank you very much. We've got a couple of questions in the chat, so I'll read them out. I mean, the first one is clearly we're impressed with the work that's been done. What were the biggest challenges you felt that to implement the pathway and its successes?
Conscious I'm doing all the talking. Sorry, Becky. Come in whenever you want to.
No, fine.
I think like anything, when you start something, you always start with grand ideas. And I think that my learning has definitely been to be patient. So, we're obviously in 2025 now. I started on this journey in 2019, and I had to really start small and make sure that I'd got all of those foundations in place and right before we then start to supplement that with some of the other work. So as I mentioned at the beginning, I had a speech therapist for 2 days a week. That then sort of grew to who we now have, which is Becky, which is a full-time role. But we had to start much smaller and develop that sort of the pathways, the processes, that thinking behind it to then evidence that need for it to be something more substantial and more sort of long-term. And that's how we then got the agreement to have what is now Becky's role, which is that full-time speech therapist overseeing the service.
Becky, do you want to add anything to that?
Yeah, I was going to say it was adapting our pathways as well initially. I think in terms of we'd gone in with the ideas of what it would look like Alison said, but actually the needs of the children had changed drastically. We started in November 2022 accepting referrals, so we were just we were seeing those lockdown babies as they were turning 2. So obviously their needs were very different to what we'd expected. But actually we were really lucky with the team of Talking Together practitioners that we got, that they actually just absolutely took that ball and ran with it. They made it their own. And it really highlighted that need to invest in the professionals, and that the early years of kind of workforce are really what can make the difference, because they've got that such rich play-based knowledge that they were able to adapt and work with the children and create the pathways that suited them. So making sure we weren't trying to shoehorn children into set boxes or anything.
Very good. I mean, I suspect there were general things as well, like, relationships are key to everything, aren't we, when you're trying to set something up, and resources. I suppose the third thing that springs to mind is, you kind of discover an unmet need. So you quickly realise that there's a lot more children than you might have planned for to start with. But the second question kind of connects in with that, and it says, how do we ensure that the pathway is inclusive for children and families from a broad range of backgrounds? So diversity, as you mentioned, there's some, English not being the first language. Is that something you've particularly focused on?
So with our model being established within our family hubs across Doncaster, we've got 12 family hubs, and they are in those areas where they're needed. So it helps us to access families that wouldn't ordinarily be accessing services, because they are coming into the hubs. They have a good relationship there. It's where they have their midwife appointments. So we're kind of capturing them quite early on. We also have translating devices. So if any of our families don't speak English, then we can take a translating device out on the sessions with us and have that conversation in their home language.
Again, Alison, is there anything else you want to add to that?
Yeah, I guess just the only thing really to add on top of that is that the translation device is a really good tool, but it's not a replacement for interpreting services. So we do tend to find that the devices work really well to sort of start off those conversations. But if it is identified that that family would benefit from that sort of more natural flow of communication, then we do also tap into the interpretation services as well.
Okay, thank you very much. Sorry, I've got one last question that's just come up, was just in regards to how have the workforce found it? What's their feeling of the programme and how it's been implemented?
When you say workforce, do you mean our direct team or the wider
indeed.
workforce?
Well, your direct team initially, but if there are a broader sort of partners than that who are now connected. I mean, you mentioned about health visitors. I suspect that they would be the other workforce out with your direct control.
So in terms, I'll start with the broader question. I might let Alison narrow it down after, but in terms of the wider workforce of health visitors, community nurses and nurseries and childminders, our practitioners build really good relationships. So Doncaster is split into 4 localities, and we have 1 practitioner in each locality. So they're able to really build those relationships with named health visitors, community nurses, and the nurseries and childminders that crop up quite frequently for our children. It means then that those professionals are quite happy to just pick up the phone or send an email asking questions, or I've got a child who's presenting like this, where do I go for support, or what's the next steps? So we have had some feedback from them that actually they found it really useful having that person. Sometimes you don't want to put a referral in, or they don't need a referral and you just need a little bit of a pointer. So our practitioners provide that friendly face for them.
Yeah, and I think just to back that up, so one of the things I think that our entire workforce has found really helpful is the way that we communicate with them. So we always make sure that they receive a summary of the work that's been completed, so they get that real holistic information around the fact that their referral has been sort of accepted, that their child is receiving that support, but also what the difference that has been, so that they feel quite reassured that they can see the value and the benefit of that support, which then leads to them sort of being more willing and sort of wanting to continue to work with the team. We were extremely lucky. So we started the process with 2 practitioners, and that then grew to 4. And we've had all 4 of those staff have been amazing. Really sort of proactive, productive, creative practitioners that really are the true sort of reason for the success of the programme today. And they do sort of really feel very proud, don't they, of what they've achieved, and they should do.
Yeah,
it's nice to hear you've recruited people of with that feelings, and also they'll be productive, but I think also from you leading them and them giving them some autonomy to act in their work. So thank you very much for that. It's been nice to hear from allied health professionals. It's been nice to hear from an area that probably doesn't get huge focus in our day-to-day sort of practice. So that's brilliant to hear that. And I think what we've done is put in the chat is the timetable for the future hub meetings. Well, I'd like to thank our speakers once again. As I said, thank you very much for everyone's time today. As I said, we have recorded it, so people have an opportunity to look back once again, and I wish you well in your programme going forward. So I'm going to close the session. Thank you very much, and goodbye.
Thank you.
Thank you.